Hello everyone, thank you for joining this webinar. I am Poonam, Monitoring and Evaluation Manager of Water for People India. Today I am presenting on the driving database decision using digital platform for building better service delivery. I am sharing the experiences from West Bengal and Bihar, the states of India. Water for People India works on everyone forever model and aims to provide universal access to safe drinking water, sanitation, and improved hygiene practices, which is sustained by local institutions, private sectors, and government. Water for People has implemented its program in 4 states, 9 districts, and 11 blocks. So far, we have reached 1.8 million people. Water for People also providing its technical support to government's Jal Jeevan mission, the water program, and also the Safe Swachh Bharat mission, the sanitation program. Our Destination 2030 objective is to create local water system to improve services for more than 10 million people locally and strengthening the national water system to improve wash services to 100 million people. We are working in 2 districts of West Bengal, South 24 Parganas and Birbhum district. While working in these 2 districts, we found certain challenges which was related to the data. We can say the lack of the trusted data available. So there was no baseline data available for the planning purposes or the reporting purposes. There was lack of visibility at the service provider level and their performance while working at the scale level, no mechanism for the monitoring so that we can use it can be used for the decision makings, and also there were very poor utilization of fund due to lack of the trusted data. So we thought of doing experiment and using the digital platform to collect certain data which can be trusted real-time data and used for different purposes. So we introduced the digital platform PDA, Participatory Digital Attestation Program, for the training purposes because there were the lack of training data as well for the service provider whose capacity and has been built, and they were not registered anywhere. Also, there were the lack of this kind of data with the government so that once they can identify and they can use these providers for the different training programs. The Participatory Digital Attestation Program is a platform which provides different things, many facilities to the trainer as well as the trainee who has attended the training. They can use the different content from this platform. So it helps in building the capacity and empowering the frontline staff or the service provider to get their job done. Also, since it is the digital attested program, so it is digitally attest all the interactions in the field and use the data for the real-time monitoring. It is a system generated program, so trusted data which helps in the decision makings, since all the digital content are stored in this app, so the service provider can use it time to time, hence it enhances their self-efficacy. Also, the data stored in this platform is visible through the dashboard and can be used by the different multiple government agencies, officials for the further programs. Once the training to all identified master trainers and the service provider has been done through the PDA platform, now the government utilize them for collecting the baseline data, and for this we prepare the 7 digital content and 7 survey formats to record the baseline data. Through this process, using this digital platform, around 0.37 million household surveyed and its data has been analyzed. Around 3,905 public institutions were surveyed to understand the present condition of the water mission, the Jal Jeevan and the Swachh Bharat, the sanitation mission at the public institution level. Public institutions include the schools and the health clinics. We found that 21% households having functional tap connections, 93% in schools and 61% AWC having drinking water facilities, drinking water sources, around 64,807 households just having the platform constructed for the piped water connections. And we also found that there were 18,700 non-functional and 18,063 households were having partial functional tap connection. All these were the real-time data was visible through the dashboard, and it can help in real-time quick decision making. Since using this digital platform PDA, the real-time data was available and government can quickly see through the dashboards. The data was used for the quick decision makings, and based on this, the service provider or the data collector's remuneration was released. The government released around 1.1 million Indian rupees towards the remuneration of these data collectors. It also helps to build their confidence, and also now they are visible to the government and can be used time to time for the other training program or the data collections. Also, this data has been utilized by the government by feeding into their own monitoring systems and identifying the functional and non-functionals, the tap connections, also the household which are having the single pet or the other sanitation related indicator. It also helped at the planning level. This data was basically used for preparing the detailed project report in terms at the GP level for the liquid and solid waste management. After successful piloting in West Bengal and the real-time data we collected through a PDA platform used for the planning purposes by the government, similar platform we used in Muzaffarpur district of Bihar, where we found challenges related to the tracking the operation, tracking the tariff collections, and dealing with the operation and maintenance issues. In Bihar, there were no mechanism to track the fee collections from the household and also generate the bill. There were no mechanism or the digital platform available to track the revenue and expenditure at the ward level by the ward implementation and management committee. Ward implementation and management committee is responsible for implementing public schemes at the ward level, in the wards at GP level. And also this is their responsibility to track the progress of these public schemes. Also, since there were no mechanism to track the functionality of the PWS systems, the pipe water systems, so we tried it to use a proxy for the functionality. And while tracking these data, we just interpreted that these schemes are functional. It is important to train, organize and engage the frontline worker or the service provider as well as their supervisor or the associate stakeholders. The PDA platform was used to fulfill this purpose, and it helped to build the capacity of the service provider on operation and maintenance and other themes. Also, it helped them to show their visibility and also their engagement and the task done by them on day-to-day basis. This platform also help ward implementation and management committee to take care of the expenses, to track the revenue and where to spend, how it has been spent and who is spending that money. This PDA platform also helped in regulating the work of the service provider and providing them a sense of fulfillment after accomplishment of their task. Once the training has been done, we created a M-Gram Saver platform where they can record these data, household level data, who are paying their tariffs, when they are paying, and through this platform they can also generate the bills. So this mobile based application enables water committees to collect and manage their revenue and expenditure Also, it helps to generate the reports and share it over the WhatsApp. After using this PDA platform and mgram Saver Portal, we were able to track the tariff collection data over the 1 year, and it is a real-time trusted data through which we were able to track the revenue and expenditure, as the platform includes both the facilities, and this slide shows the track records of the tariff collections in three blocks of Muzaffarpur districts, where as per the baseline, there were the 20% tariff collection or less than 21 collections, and there were no specific records were available. Some of the records were available in the register, but not from all the three blocks records were available. So while these tariffs are being collected on the regular basis, so the this was used for the operation and maintenance by paying the electricity bills and minor repairs, which helped further in functionality of the pipe water scheme. So the digitally captured data helped in different ways, like tracking revenue and expenditure. It also satisfied the consumer as they were getting the monthly bills of their payment. While looking forward, it is proven that the use of different digital tools make the system much more efficient, and the PD-based approach is a demonstration of how this can be made possible. Even though the experiment have demonstrated success, it is still effort now is required for the advocacy with the government to use its adoption at the larger scale.